Whenever I mention the word insulin in my consultation to my patients, there is a big long pause. And it's almost like the tortoise, when it senses any danger, withdraws its legs and arms. So that's how our patients go into a little shell. They stop thinking and they stop listening. Today, I want to think from patient's perspective what's going through their mind when we say the word insulin. Why there is so much of reluctance and hesitancy to accept the fact that they need to go on insulin. Let's check out what's going through their mind. So, the first thing that goes through their minds is this: they take it as a personal failure, they start blaming themselves for not controlling their own disease, and they live in this constant guilty feeling, whereas they need to understand that this is a natural course of the disease and they couldn't have done anything to prevent this happening. It's not your fault. Then they often start thinking, is this the end of the road for me? Have I got really seriously advanced disease and my doctor just doesn't have anything else to offer to me? But in fact, it could be a new beginning and your doctor is just putting you on insulin well in time in order to prevent or delay the complications. Now, I find this a little funny in a way because insulin is a natural substance and there is no way you can actually get addicted to it. So, this is out of question. But look at this one. This is our patient's biggest worry, isn't it? Once I go on insulin, will that be for life? An answer to this question is quite individual. Often we put patients on insulin if their blood sugars are really high initially when they're diagnosed, or if someone is actually due for certain surgery or operation, or if they're admitted with certain infection as a short-term measure. But once you go on insulin, that does not mean that it would be for life in many cases. Now, nobody likes injections. The very thought of having an injection itself can be quite traumatic for many. But let me tell you that the modern insulin needles are only 4 millimeters, and the discomfort that someone gets from it is actually less than what you would get from finger pricking for testing your blood sugars. Moreover, the pen devices that are there these days are very easy and convenient way to use it. We get this a lot. I won't be able to go out to have a late night meal. I won't be able to travel for my work. And insulin will just ruin my social life. In fact, let's look at it this way. If you go on insulin, you're actually in control of your own day. You know exactly when you're going to have meals and you feel like you're in charge. You can actually discuss this with your own doctor as to what regime or what type of insulin suits you and your lifestyle. So it's not really too restrictive as you would think. It's often down to the experience that that person has had with their family members or relatives. They may have seen other people with diabetes who had kidney failure and thinking and linking insulin with it. But let me tell you that insulin, in fact, can prevent or delay these complications like kidney failure or blindness or death. This is a cheeky one, isn't it? I can eat whatever I want. I don't have to do diet and exercise if I'm on insulin. Now, this is not true because you remember you still need to stick with your diet and have a good exercise regime. Otherwise, your sugars can fluctuate from hyper to hypo if you have erratic dietary pattern. So you still need to remember to follow your lifestyle advice. I hope this video actually helps you to clear some of the myths and fears about insulin. Thank you.